Well, a very good day to everyone joining us for this webinar from across the globe. We appreciate you joining us here this morning or this afternoon, wherever you may be. I'm Charlie Rodriguez. I'm one of the organizers of the World Medical Tourism Congress, and I'm joined today by Kalyan Duda, who is representing the Times of India, our partner on this event to be held March the 7th through 9th in New Delhi in India. This will be the first ever World Medical Tourism Congress in India. We've made a 5-year commitment to this event. We're very excited to be bringing the Medical Tourism Association to India for the first time, and we're very, very excited about our partnership with the Times of India group. I just wanted to jump in now and tell you a little bit about who we are as organizers of this event. The Global Healthcare Resources and the Medical Tourism Association are the most recognized brands in the medical tourism space. We are the recognized leaders in this industry. We've worked with governments and healthcare systems in more than 100 destinations across the world, supporting education, transparency, and raising standards across the industry. We organize the largest medical tourism events in the world. We organize workshops all over the world. We publish the Medical Tourism magazine, along with the Corporate Wellness magazine and Health and Wellness Destination Guides. We are the leaders in training and certifications for both individuals and for institutions. And we also provide the leading accreditation program through our global strategic partner, Global Healthcare Accreditation. We have over 2.1 followers on social media. We manage about 30 different groups in LinkedIn. We're very active in Facebook, and we touch over 2.1 million professionals around the world. I'll let Kalyan jump in now and tell you a little bit about the Times of India group. Kalyan, good day to you.
Hello, everybody. Thank you for being a part of this webcast. And in fact, representation from Times of India, I would like to go ahead and put across a point. I'm very sure as Indians, everybody would be aware of what Times of India is in India. We were the first forerunners to start the print media in the country with approximately 78% market share currently. 13 dailies is what we run currently across the entire country, with Mumbai Mirror being the most dedicated print which we currently have, having maximum circulation across the West. Now, apart from print media, in the later stages of our development, we also have gone into broadcast, which gets us to Times Television Network, which predominantly holds Times Now and Economic Times Now as two predominant channels, which airs and broadcasts daily news to approximately 78% of the Indian population across the city of this given country. Now, we have 12 consumer magazines and 6 business-to-business dedicated magazines as well, and currently running with a total strength of 11,000 employees, which dedicates to the entire Indian fraternity to give them concrete news on a daily basis. So that's what we do from a print front. And yes, over the last 5 years, the Times Strategic Solutions Limited, we are a wing of Times of India, which does business-to-business conferences and expos to give exposure to the business-to-business platform and networking for our leading corporates of India in each and every sector and industry. Thank you, Charlie.
Thank you, Kalyan. And to our international guests, this will give you a better understanding of the reach that you'll have into the India market for those international organizations that are interested in penetrating this market. We have, again, as I mentioned, we've organized workshops and events all over the world. Just this last year in 2016, the MTA had events in Malaysia and Colombia, in Austria, Bulgaria, Puerto Rico, China, Washington, D.C. That's just to mention a few. Also, the staff and the leadership of the MTA are frequently invited to participate in events around the world as expert speakers and as advisors. Why did we choose India? And before I get into some of these details, and I'll ask Kalyan to join in as well and tell us a little bit more to our international guests about what to expect in the Noida and the New Delhi area. As important as why India is why India now. And I think when we look at the India market in medical tourism, we see that India has been quite active regionally for many years. Has been a force and has attracted patients from all across the region due to the world-class healthcare system, the world-class hospitals, as well as unmatched physicians who have trained abroad in the UK and the US and in other parts of the world. This space has been really driven and dominated by the private sector over the coming years. And what we've seen is steady growth, but we've seen some erosion in that growth to other regional powers that have come on the scene and have had more consolidated efforts and more of a support from the government or public sector. And what we've seen more recently in India, which has really interested the MTA and really has motivated us to get involved, is under the leadership of Prime Minister Modi and with the support of the various ministries and the formation of the Medical Tourism and Wellness Travel Council, along with the support of the NABH and other in the public sector. We've seen an effort to consolidate and to really support the initiatives to raise standards and create general standards across the board, and to really to promote India as a destination. So as importantly as why India, and we we'll share some of that information with you. We think it's important that the time is right for international organizations that want to move into this space and to want to come into India, that the conditions are very good now. India, as many may know, is the second most populated country in the world with more than 1.25 billion people. The economy of India is ranked 9th in the world with a GDP of just over $2 trillion. The Indian medical tourism industry is expected to reach US $6 billion by 2018, with the number of people arriving in the country for medical treatment set to double over the next 4 years. India has been ranked number 5 among destinations in the Medical Tourism Association 2016 Medical Tourism Index. Again, I mentioned the presence of world-class hospitals and skilled medical professionals, the superior quality of healthcare combined with low cost for treatments compared to many Western countries. This is very important, and this has been one of the key factors and drivers in the Indian market, is the high level of healthcare associated and in combination with prices that in many times can be 70, 80, even 90% lower than those of the West. There's no language barrier in India for English speakers, and with the holistic treatments of Ayurveda, yoga, and homeopathy, and so many other traditional methods that are used of treatment used in India, attract more and more travelers from Europe and the Middle East. We see India, traditionally as a crossroads between East and the West, and certainly in the healthcare space as well. Kalyan, can you tell us a little bit, for our international guests, a little bit about what to expect in the New Delhi and Noida areas?
Yeah, sure. Charlie, to give you, I'm very sure for our international guests, Delhi becomes the New Delhi, in fact, is the capital of India, wherein we have the central government placed and positioned out of the New Delhi area. Noida being one of our top industrial areas, it is featured under Asia's leading industrial development areas currently. And unlike other parts of India, you will see approximately 5-lane highways in Noida, which ensures that there is no traffic congestion, which gives us easy commuting from one point to another, which basically saves time for us first. And apart from that, it is also surrounded by a lot of monumental destinations, like you have an Agra nearby Noida and New Delhi. We have some hill stations nearby New Delhi as well, which basically gives New Delhi a flavor of having more of a tourist attraction than any other city in India. So having said that, Noida, the destination, the place that we are hosting this given conference, the Noida Exposition Mart, it is very centrally located, approximately 50 minutes away from New Delhi. And if you're looking at transportation, easy transportation is available. The staying nearby the destination and the location, we have Radisson Blu, we have the Crown Plaza hotels, which are approximately 10 to 15 minutes away from the Exposition Mart. So it is easily accessible with all the amenities and the requirements that we currently need. And we would like, as Times of India and NTA, we would like to invite all of our international guests. The hospitality would be on us when you come to India, specifically to Noida. Off to you, Charlie.
Wonderful. Thank you, Kalyan. And again, for those international guests, we are going to be making sure that you have every comfort. We've negotiated rates with the 5-star hotels in the area, and we're going to be also, providing shuttle service to and from the hotels to our guests, to the exposition center. So everything will be taken care of once you're in India. And also, we want to, of course, make sure that all our, local guests will be there to really show you Indian hospitality and the local flavor. There are some very attractive opportunities in the medical tourism space, in the healthcare and wellness space, and particularly when we look at India as a market. Again, we mentioned the cost of medical treatment in India is on average 1/8 to 1/5 of those in the West, and rising income levels and an aging population also contribute, to these business opportunities. So, the ease of travel, the ease of information, the internet, all of these factors are contribute to patient mobility. Of course, factors such as telehealth and mobile health and other technologies have also contributed to patient mobility, and also create a lot of business opportunities, not only for healthcare providers and for buyers of healthcare, but those of you that are in ancillary services such as technology, such as advisory services, consulting services, will find very attractive opportunities, and particularly in a growth market such as India. Health and awareness and changing attitudes around the world is for, and for India in particular, there are favorable governmental policies, and the growth of all of these other health and wellness sectors all contribute to great opportunities in this growing market. Healthcare spending is over $280 billion. The overall Indian healthcare market is worth about $100 billion, expected to grow to $280 billion by the year 2020. Some of the factors against contributing to this great growth in healthcare spending are a growing middle class, increase in lifestyle diseases such as heart disease, diabetes, and others, an aging population, and of course the accessibility and availability of higher quality health care. When we look at the medical tourism industry as a whole, what we've seen is some very interesting trends and developments regarding developing markets. Traditionally, in the past, the medical tourism industry has been primarily about patient movement and patient mobility. So it's been healthcare providers and buyers of healthcare, such as insurance companies, and and governments have been the major players in the industry. But as we see more and more developing markets such as India and Thailand and markets in Latin America and Asia have developed medical tourism programs, we've seen the trend of these markets seeking outside experts to support their efforts to build capacity, to develop clinical programs, to train physicians and nurses for consulting and advisory services, technology solutions such as, again, software and telemedicine and accreditation organizations as well. So if you are not only a healthcare provider, but if you are an expert and you can provide services to help these developing markets build their programs, train their professionals, provide technology solutions, the medical tourism industry is a fast-growing industry and will provide unmatched growth and opportunities for business. And again, just to expand on that a little bit, traditionally, what we saw 10, 15, 20 years ago was governments, insurance companies, employers, and facilitators were dominating the industry. And as this has evolved and we've seen new markets develop and new markets grow, we've seen more healthcare systems. For example, if you're joining us today from the United States or from Europe, or from the Middle East, and you are an administrator or an executive in a hospital, and you're wondering why you should come to India, this is a great opportunity for U.S. hospitals, for European hospitals, hospitals from the Middle East, top healthcare systems to come in and to develop affiliations with the Indian hospitals, and indeed the hospitals around the region that will be at the event, and develop affiliations, training, for training physicians, for physician exchanges, and those types of opportunities. So these are the evolving markets and the evolving opportunities that we see in this industry. Which is the new buyer profile that we're talking about. Investors are coming into this industry. Healthcare systems, again, who are looking to not only to expand their brand internationally, but to also to develop affiliations across the world. New destinations entering the market every year, again, looking to develop their programs and to attract more international patients. Governments are initiating programs. We mentioned the initiative by Prime Minister Modi and Minister Sharma to develop the Wellness and Medical Tourism Council in India, and of course there are many initiatives like this all over the world. So these markets are shifting, and what were traditionally looked at as providers are now looked at as investors and buyers in the industry as well. Now, a little bit of an overview of what you expect at our events. Many of you on the webcast today have attended our events, but for those of you who have never been to a World Medical Tourism or WMTC event, our events are unlike any other in the world. There are many medical tourism events. Indeed, there are a lot of medical tourism events in India. So what distinguishes our event from some of these other events? Number one is our agenda and our educational platform, and number two is our buyer program, and we'll talk to you a little bit about that in a minute. And certainly our attendee profile is something that distinguishes this event from others. So at a WMTC event, you'll have an opportunity to network and to meet with leaders of insurance companies, industry leaders, professionals, third-party administrators, of course, healthcare providers, wellness industry stakeholders, employers, multinational corporations, software technology providers, government organizations, medical tourism facilitators, as well as other industry professionals and stakeholders. What is the WMTC experience? An unmatched agenda, including top industry professionals, engaging speakers, executive summits targeted for different leadership groups, unmatched networking opportunities, industry forums, on-site certifications, brought to you by the leading professionals in the industry trends. And this year in India, we're very excited about the Taj Mahal tour. For those of our international guests, this is a once-in-a-lifetime opportunity. We will be inviting our VIP hosted buyers, as well as our top sponsors, to participate in this wonderful one-of-a-kind tour. We'll also be organizing some site visits to some of the major hospitals in the area. So you facilitation companies or insurance providers that are coming internationally and want to connect to the leading hospital groups will have an opportunity to visit some of those hospitals. Kalyan, can you tell us a little bit about the Taj Mahal tour and perhaps about some of the site visits that we are planning?
Definitely. Charlie, so basically, post the 3-day conference, I'm very sure we would want our guests to have an archaeological view of India through a Taj Mahal visit, which will be organized by us, Times of India, where we would take you to this monument of Taj Mahal, which has a history beyond 150 years. It's basically a tomb. It's a huge caricature which is built completely of marble, and probably it is one of the 7 wonders of the world. So that's one of the attractions that we have, where we would have all our guests, our international guests, to be a part of this visit. Alongside, I'm very sure there is one attraction which most of our international guests would be looking at. India, specifically New Delhi, and to be more specific, Noida, had hosted one of the Formula One races back in 2014. Post that, we haven't had any Formula One racing in here, but we still have the Budh Formula One circuit, which still hosts most of us, the adrenaline junkies, with Formula One cars for dragging and for racing in those tracks. So that will be one more attraction wherein we have taken up special permission from the exposition center and from the Budh racing circuit to give you an experience of the Formula One, though without audience, but yes, with the driving of these fast cars. So those are the 2 attractions which we have decided specifically for our international guests as a part of this given tour. And yes, nonetheless, we can definitely going to have some good networking, gala dinners and cocktails with some good luncheons to get a good business platform for networking. On to you, Charlie.
Thank you, Kalyan. Breaking news on the Formula One experience. That's very exciting indeed. Okay, I want to get into a little bit about our VIP health care VIP buyers program, and particularly for many of our local attendees in India. If you are joining us this morning or this evening in India, and you are an executive of a healthcare organization, a hospital healthcare group, a specialty clinic, and you want to highlight your program, you want to highlight your facility and your services, and you want to showcase to the rest of the world. This is an unmatched opportunity. Again, we're quite aware that there have been and continue to be many medical tourism events in India, but our event is quite different. So if you're an India healthcare provider, many of you have come to our events in the States, but this will be our first event in India, and this will be your opportunity really to showcase your hospital, your clinic, or your services to VIP buyers in India, which we are going to be bringing from around the world. Our MTA buyers program is unmatched. We have developed over the years relationships with governments, with facilitation companies, with insurance companies all over the world. We have a dedicated staff here at the MTA whose sole responsibility is to develop relationships with these buyers, to identify with them, to vet them, to make sure that they're qualified, to make sure that they can demonstrate that they are sending volumes of patients outbound and inbound from multiple destinations to multiple destinations. We have a lot of buyers of healthcare who apply for our program, who may be, considered buyers from at other events that don't qualify. In other words, if you're a buyer of healthcare and you are just inbound, bringing patients to one destination, that doesn't qualify as a buyer, a VIP buyer. We of course invite you to the event, and you will enjoy the event, and you will benefit from being at the event, but you will not qualify as a VIP hosted buyer. So we have a very strict and very stringent policy where we, again, identify these buyers, we develop relationships with these buyers, we provide free registration, discount registrations, hotel rooms, flights. So don't miss this opportunity to showcase your hospital to the world and to network with these buyers, and to again, have an opportunity to make these connections in India. Who are qualified buyers? They are ministries of health, international insurance companies, U.S. multinational employers, facilitation companies, travel agencies, referring physicians, and others. What we've done is we've divided the world into 9 regions. And so we have Africa, Europe, Asia, the Middle East, Russia and the CIS countries, Canada, the USA, Caribbean, and Latin America. And by dividing the world into these 9 regions, we're able to focus and develop relationships in these regions, and relationships which we can then leverage to bring to our events, and to provide our members with access, and our sponsors and partners with access to these different regions, which geographically make sense, and which feed their markets very effectively. And I want to talk about a couple of the buyer profiles, but you can log on to our website, the Congress website, medicaltourismconference.com. We are updating this site daily, so if you'd like to log into that site and look at some of the different buyers who's coming to the event, we certainly encourage you to do that. But individuals such as Khalil Ahmad Mohammed, president of Max Global Consulting from Afghanistan, GMA Hakim from Oman, who is the founder and CEO of Al Hakim Medical Tourism, a gentleman, Mr. Dorj Bhat, the general director of New Link International, sends thousands of patients from Mongolia to destinations in the region. Mr. Saif Al-Jabeji, the CEO of MAE United Healthcare Group in the UAE. And these are just, again, a few of the profiles. I encourage everyone to log into medicaltourismconference.com. We've got Dr. Guzan from Kazakhstan, Mr. Ashab Hiba, excuse me if I'm mispronouncing some of these names, from Uganda, from the MedTour Medical Tourism Company, Dr. Osh Luwu from Nigeria, Olga Karakich, the executive director of Indigo Medic in Russia. And again, these are just a few of the hosted buyers that you'll have an opportunity to connect with at the event. So we encourage everyone to if you haven't registered for the event, certainly to do so. There are still sponsorship opportunities. How do these buyers find you? Is number one, by having a presence in the exhibition hall. When we've got thousands of attendees at an event, you'll increase your chances of connecting directly with these buyers a great deal by having an exhibition booth or some sort of partnership or sponsorship at the event. Will certainly afford you more opportunities to connect with some of these buyers. And what are some of these opportunities look like? Insurance company from the GCC sending 20 patients a month overseas. An African facilitator sending 4,000 patients to India for healthcare. A Saudi Arabian partner who sends patients all over the world for transplants, cancer treatments, and other complex cases. Iraqi facilitator sending 8,000 patients a year overseas. A Dubai insurance company covering over 500,000 lives. Another Dubai facilitator, sending over 200 patients monthly overseas. We're going to also on the agenda have an opportunity for your organization to showcase what it is that you do, present your case studies. So if you're an Indian, healthcare provider or a healthcare provider from anywhere in the world that wants to showcase your services, what it is that sets you apart, there'll be a great opportunity on the agenda. These opportunities are limited, so please contact either Kalyan or myself today to make sure that there's still space on the agenda to present your case study. Kalyan, if you'd like to add anything at this point, and I know that we also have joined us on the panel this morning, Mr. Yogesh Vyas from the Times of India. Yogesh, would you like to say good day to our guests here on the webinar today? Yogesh, are you there? Okay, we may be experiencing some technical difficulties on the other end, so please bear with us. Moving on with our overview of the agenda is our Certified Medical Tourism Professional Workshop. For anyone who is either a professional in this industry, whether you work for a hospital, a healthcare provider, whether you're a medical tourism facilitator, an insurance professional, anyone really in this industry that wants to distinguish yourself, that wants to advance your own professional career, and to really demonstrate that you understand this industry and hold yourself to a higher standard, you'll have an opportunity to join us in person live for a Certified Medical Tourism Workshop, which will be conducted by our seasoned and professional trainers here at the Medical Tourism Association. And this is a comprehensive workshop that will really give you a great deal of information about the industry, how to work with patients, how to work with healthcare providers, and how to really distinguish yourself as a professional. Normally, this course costs $1,500 is the normal cost for this course. It also comes with a membership in the MTA, which provides valuable benefits and engagement all year long. And this course can normally be taken online or live at one of our events, and we have really lowered the price significantly for our event in India. We want to make sure that all of our guests in India have an opportunity to take advantage of this course. So we lowered the price to only $400 for our registered attendees for this course. So if you've already registered for the conference and haven't registered yet for this CMTP workshop, we encourage you to do that. If you haven't registered online yet, we're going to provide a code at the end of this presentation. Well, you'll have an opportunity to save up to 20% on the registration. So stay tuned for that. What are the benefits of certification? Offer a higher level of service to your clients and or to your employer. Learn the best practices in international patient management. Add to your portfolio a new niche business model focused on medical, dental, and wellness travel. Set yourself apart from the competition by showing your commitment to excellence to consumers and buyers of healthcare, and enhance your career and your own personal brand, as I mentioned, and set yourself up for new job opportunities and promotion. What will you receive when you complete the program and pass the exam? You'll receive a 3-year membership to the Medical Tourism Association. You'll gain access to online continuing education resources. You'll gain credibility among your peers in the industry, and you'll be able to offer a higher level of knowledge and experience to your clients and your customers and employer. What are some of the top sponsorship opportunities? And as we call them, partnership opportunities. So if you really want to, if you're coming to the event and you want to increase your visibility, if you want to increase your brand awareness internationally, you may want to consider sponsoring a VIP or a cocktail gala. Be a sponsor of the Taj Mahal tour, where we're going to, bring our VIP guests with us on a bus tour to the Taj Mahal. As a sponsor of that, you'll have an opportunity to network with those individuals and be recognized as really a facilitator of that tour. Sponsor an expert panel. Perhaps you want to showcase something that you're doing that is cutting edge, or sets your organization apart. Why not sponsor a panel? Bring in some of your panelists, some of your top rock star doctors or physicians to participate in the panel, and really highlight that and showcase that to our attendees. Sponsor the registration, sponsor the attendee lanyards is a great way to gain visibility. Sponsor one of our tea breaks, or sponsor the networking lounge. So these are some great opportunities. Of course, there are other opportunities that are still available. They're going quickly, so please, after this webcast, make sure that you reach out to myself or to our friends at the Times of India to learn more about some of these partnership opportunities. Another great way to really set your organization apart and to be able to target an audience and have exclusive access to our buyers or to any particular group that you want to target is to host a private lunch or a cocktail. We will take care of all of the logistics. We'll send out all of the invitations. We'll send out all of the reminders. We'll target the audience for you. So if you're an Indian hospital and you want to meet with our buyers from Africa, from the Middle East, we can make that happen. We can organize a private event for 20 or 30 individual VIP buyers. You'll be the star, you'll be in the spotlight, and we'll take care of all of the details for you. We can only do a very limited amount of these hosted private events. So if this is something that you're interested in, please make sure to speak to us about this right away so that we can make that happen. So you want to be in the spotlight, you want to be seen and be known, you want to showcase India, you want to showcase your hospital or your clinic and your services to international hospitals, airlines, medical tourism facilitation companies, tourism boards, government officials, healthcare and tourism development consuls, law firms, technology providers. This is the platform to do that. And we certainly look forward to welcoming you and to having you be a part of this first ever WMTC in India. As promised, we are offering a special webcast discount registration code only to those of you that are on the webcast today. So if you go to medicaltourismconference.com and you register and you use the code GOINDIA 2017, you will enjoy a 20% discount off the cost of registration, and that code will be valid from today until February 1st only. So again, we want to thank you for joining us today, and as our thank you, we are offering this special discount. Now, we have quite a few questions from the audience, and we're going to go to those now. We have Sandy from New Delhi who has asked us how many buyers are we expecting and how do we lead them? Sandy, that's a great question. Again, hosted VIP buyers, we're expecting up to 100 hosted VIP buyers, but of course that does not include all of the buyers at the event. There'll be many more buyers at the event. Again, there'll be, many facilitation companies from India or some startups that are new to the industry that will be at the event. So you'll have an opportunity to connect with buyers from all 9 regions of the world. So whether you're looking to reach out or to expand your reach in the MENA region or the Africa region or the CIS or to the US market, this will be a great opportunity to connect with buyers from all over the world. Who should take the Raj from Belgium? Who should take the CMT courses? Raj is a newcomer to the industry, and certainly we encourage all newcomers to the industry to take this course. This is a great opportunity, again, to gain critical content. But again, also, if you work for a hospital, if you work for an insurance company, if you work for, if you're a consultant, if you work in this industry in any capacity, I myself have taken the Certified Medical Tourism Professional CMTP workshop twice. I've been in this industry for 6 years now, and I've benefited both times that I've taken the course. I've learned something new, so I find it quite helpful. We've got 1 or 2 other questions, but we're running out of time. Are there still any sponsorship opportunities? The answer is yes. There are still sponsorship and partnership opportunities. Please make sure that you contact either myself. You can contact Yogesh or Kalyan. Here is our contact information. And someone from the Philippines who is in the wellness industry and wants to know if they should attend the event. And yes, as you may know, the GHR and the Medical Tourism Association are also the dominant players in the corporate wellness space. We publish the Corporate Wellness magazine, and we are, leaders in that space. So there will be space in the agenda for wellness. And then, of course, with specific to India as well. India has, for centuries been a leader and a destination for wellness travelers from around the world, whether it's for yoga or Ayurveda or other holistic treatments. So again, there's quite a synergy and a fit there, not only with the destination, but within our organization as well. So we encourage anyone who is looking at the wellness industry, as well as medical tourism industry or technology, M-health, telehealth, all of these industries will benefit greatly from this event and from participation in this event. What countries are coming from the Asia market? We are, a question from a gentleman in Thailand. We are expecting guests from the Philippines, from Thailand, Malaysia, Bangladesh, Kazakhstan, from the Middle East, from the MENA regions, from all over. So this is a regional, a global event. This is an opportunity for you to penetrate this not only the India market, but the Asia market, which is the fastest growing economic market in the world, and an opportunity to grow with us as we continue to grow this event over the next 5 years. So it's always exciting to be the first and part of the first event. Of course, we could not bring you these events without your support. So we need your support. We need everyone to register, everyone to support the event, so that we can continue to grow this event and to continue to organize and grow these events all over the world. We're expecting a networking app to be released for the conference. This is coming from, it looks like it's coming from one of our sponsors, that has used it very, very effectively. So stay tuned for more news on about that. And with that, I want to turn it over quickly to Kalyan, and hopefully Yogesh has been able to join us. Gentlemen, do you have any comments or last moment thoughts?
Charlie, I just would like to conclude saying that there is a very important survey and a report which has been published by the Economic Times. Probably once we share the recordings with all our attendees, we should also share that particular slide and that particular news. So eventually, the survey states that there were 68,000 medical tourists which visited India in 2014. That number has outgrown by 80% at the end of 2015, which now states there were 1,38,000 visas issued only for medical tourists to India. So definitely I can make a statement by this that India is the next destination. Now being the fifth, we will definitely become the third by 2020. What say, Charlie?
Yes, absolutely. And, you know, most importantly, as I mentioned earlier, we see a great deal of trending momentum with India. In the past, again, this has been driven by the private sector, and there hasn't been a lot of consolidation. But now with this effort really from the public sector and the support, you know, the great support of the Indian government and the quality of care, all of the factors are there for continued growth. One last question. I have time for one last question. One of our attendees wanted to know what would be the benefits for a small country like Bhutan. This is a great question because, you know, this type of event, we started 10 years ago with less than 300 people at our event in California. And we've seen a tremendous amount of growth over these past 10 years. And a lot of it has been, you know, from countries like Costa Rica and Mexico and Thailand and India and others, Malaysia, where 10 years ago they were perhaps in a position like Bhutan or some of these other small countries. And through, you know, through the education, through the networking and through these kinds of platforms, these destinations have all grown into world-class power. So why not a small country like Bhutan come to the event, learn from the experts, see what others are doing, and you can duplicate those efforts, and you can also carve out a niche for yourself in this exciting and growing industry. So we hope to see you at the event. Again, we appreciate your support and your continuing support. If you have any questions, please contact myself, Yogesh. Kalyan, do you want to give your email address as well?
Yeah, surely, Charlie. Yogesh's email address is already there. The last URL is similar. The first one is kalyan.datta. That's Kalyan D as in David, UTTA @timesgroup.com.
Thank you, Kalyan. Thank you, Yogesh. Thank you to all of you who have joined us from across the globe. We look forward to seeing you in India, and we look forward to hearing from you real soon.